This is Dr. Hogue. It's January 23rd. We're doing autologous fat transfer to the hands for rejuvenation and euthyfication. Our patient is 50s, late 50s. Patient's in her late 50s. She doesn't like the prominent tendons or prominent superficial veins. What I've done is a little bit of a ring block with some 2% buffered lidocaine. First thing I'm going to do is place a little, I'm using a soft field cannula. This is a 16 gauge cannula. Make a little entry poke here. Here I've pre-filled some 5cc syringes with autologous fat. These were collected using the MMT Aquacell, using the Super G cannula that has 12 apertures in the end. Each one is 2 millimeters in diameter. So I'm going to be placing the cannula. Now you want to keep the hole positioned upwards. What we're going to do is we're going to initially target the this portion of the hand, the thenar area. So as I go, I'm going to try to stay above the veins here. Okay, now the first 5 cc's are in. Probably going to put 15 to 20 cc's per hand. Now, this entry hole should work for the whole, everything I'm going to be doing. So I'm just fanning it out, putting a little aliquots as I go. Get a little bit in the web space. Our third one. It's a matter of looking to see if there's any divot areas. Spread your fingers out all the way. Thank you. It's nice to have an awake patient. A little bit in the web space here. I'm going to take I've done 15, I'll probably do half of this one. Fill up this area. So you're actually gliding through the subdermal space here. This is not a traumatic cannula, so. That actually looks pretty good. A little spot right there. All right. Now, when I'm finished here, I want to lose my fat. We'll put just a little compression garment around here. But if you take a look between the two hands, here you see a more rejuvenated view of the same thing. Okay, now we're going to pause and go to the other side. All right, now we're resuming on the patient's right hand. Gonna make a little nick here that we're gonna be able to pass the cannula through. Here I have a 9 centimeter, 16 gauge soft field cannula, which has sufficiently large lumen here to pass this. Patient had a little bit of a partial ring block on the dorsum of the hand. She's indicated that it's been comfortable for her. So that's about how far 5 cc's went. Usually takes 15 to 20 cc's, of course depending on what the condition of the patient is to start with. And bring your hand just a little bit more, there you go. And a more radial entry site allows you to pretty much reach all of the regions of the hand that you need to do. I won't really know until 3 to 6 months how much of this fat survives. Obviously, there's a lot of variability in fat graft survival. When we aspirated this fat, we washed it twice, and we used body temp sterile saline during the irrigation of the fat for washing and cleansing. And our last syringe here, so we'll have put about 18-19 cc's in here. It's a really easy procedure to do and can really afford a lot of regeneration to the hand, dorsum of the hand. Then when you think you're done, just go back and look for any spots, and here's a little spot just so you can touch it up. Okay, so now all I'm going to do is smooth it out a little bit. You like to kind of blend it up a little bit here. Alright, that's pretty much it. So now we'll take a look at the hands. They should have a more youthful appearance. I have a little spot here that I actually want to make sure that I get adequate amounts in. But the irony is that I used the exact same amount in both hands. It was about probably 18 cc's per side. Alright, so that's a very simple, quick, easy way. What I'll do is I'll put gauze on here and wrap it with a little bit of Coban just to provide a little bit of adherent, not too much, but a little bit of a support. Patient can take these off later on today. And patient is already on prophylactic antibiotics. She's also having a body sculpting procedure. So that'll conclude this video. Thank you.